You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, she says no more dentures, that nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic. She's board-certified prosthodontist, Dr. Cespedes. Dr. Cespedes, welcome to the program.
Thank you for having me here, Randy.
Now, before we get into today's topic, for people that are not familiar with ClearChoice, tell us a little bit about your company and who the typical patient is and what the different services that you offer.
Okay, what we do is we replace missing teeth with dental implants. Whether you're missing one tooth or several, like if you're in a denture, for example, we replace those with something fixed in your mouth with dental implants.
In your center, you're the prosthodontist. What is your role in the process?
I am the person who designs the smile. So when patients come to our office, we have the surgeons who are the people that places the implants in the mouth. And as the prosthodontist, I tell them where to put those implants so that they would fit within the smile. And also I designed this smile for the patient that it's only not gonna look good in their mouths, but also gonna bring their function back. They will be able to chew with them.
Now, are there a lot of people where you are wearing dentures, like an upper or lower denture?
Oh, I would say tens of thousands of people that they're missing teeth or with dentures.
Okay, now a big part of your practice at ClearChoice, I guess people go to you, they find you when they're headed to dentures.
Yes.
That means their teeth are just need to be extracted. They don't want dentures.
You know that there's something better for them out there, which is dental implants. And that's why, you know, this is what we do every day.
Now, one of the things, and we've talked on the phone, that you say people can walk in, a denture wearer can walk in without teeth, and on the day of the procedure, they can walk out with a fixed set of teeth that don't come in and out. Is that true?
That's absolutely right. The way it works is they come in to the appointment, they have their surgery in the morning, and when they leave home by the end of the afternoon, they have the smile, but it's also attached to the implants, and so they can start a new life that same day.
You believe that?
Yeah,
that they're transforming lives.
I mean, when you go in the room in the afternoon and we put the teeth in the mouth, and then the family comes in, right? And it's this whole suspense around the mirror. And so we hold it and we give it to the patient and look at yourself. And then they take that mirror and look at it, and the families are around, people just start crying. It doesn't matter if you're a boy or girl, you know, if you're young or older, they just cry. They can't believe what's going on in their mouths. They can't believe that the teeth don't come out. They can't believe that they look beautiful in that mirror. It just changes their lives. And then 2 weeks after surgery, we have them in the office again. And they've gone through most of the healing by this point. The initial healing anyways. And then their personalities change. They come in and all of a sudden they're smiling. They feel in the room with their new personality. They're outgoing.
Really?
They're outgoing. They're smiling. They say, you know, doctor, they hug me all the time. What you've done for me is amazing. Thank you so much. The spouses, they say, oh my God, it's like I have a new husband or a new wife. They start going out to eat. They enjoy their family meetings. It's a whole transformation, not only on the outside, but more important on the inside. It's
you
just
call
amazing.
It the third set of teeth, dental implants.
Yeah.
Elaborate on that.
Well, you know, your first set of teeth when you're a baby, right? And then your second set of teeth as an adult. And if for some reason throughout the years your teeth went down the hill, you know, and they need to come out, then we can give you your teeth back, or the closest replacement to having your teeth in your mouth.
And they're permanent.
Permanent. They don't
Permanent
come out.
set of teeth.
Yep. Yep.
But back to the statement where you said, tens of thousands of people have an upper or lower denture. If attaching, I guess, these teeth to dental implants is so good, why aren't all the denture wearers coming in and getting this done?
There are several reasons.
What's your take on it?
Yeah, there are several reasons for that. One is that patients, they haven't gone to the dentist for a while, right? When you're in dentures, you don't have any tooth pains or gum disease or anything going on in your mouth, right? And so you don't go to the dentist. You don't hear about new technologies that are coming out, like dental implants, or how we can attach teeth to dental implants.
All right.
Another reason is, you know, they probably were told at some point of their lives that the bone was gone and that they couldn't have the implants anymore if they wanted to. So the second reason, Randy, it's because If you're in dentures, this means that you had a tough dental history, before. You went to the dentist to have root canals, crowns, teeth extracted. So the last person you want to see, it's me. It's a dentist.
Did they tell you that? Because nobody likes going to the dentist.
I have patients.
Because you seem so nice, right?
Well, and that helps. I try to be very calm with my patients. And the first thing I tell them is, most of our patients, they haven't been to the dentist in a long time. And our job here is to make sure that that anxiety that you have right now goes down, and that when we're done with the treatment, you will love me. Because they are anxious. They don't like going to the dentist. They are in fear.
Do they say that? No offense, doctor, but I don't like the dentist?
Yes, absolutely. Every day, at least one patient. And I always tell them, you want me to take my white coat off? Because I can do that. If people, they feel fear from the dentist. And I don't blame them. Sometimes it's been a tough life, procedure after procedure after procedure, and they're done with their teeth. They went to dentures, so they don't want to come back. And then they don't hear the good news. They don't know that, because they don't come back to the dentist, they don't know about how we can do dental implants for them.
So people are told by other dentists that it can't be done? Okay.
It happens more often than I can think of. Maybe once a week or twice a week that patients, they have been told that they don't have bone, or that they need to have sinus lift procedures. And when we tell them, you know what, we can do this for you, it's such a relief for them.
Are they skeptical, by the way, sometimes?
Yeah, they say, are you sure about this? Oh yeah, I just did the surgery on the computer, because I take some extra time for these patients, and I actually sit in the computer, do the surgery, make sure that we can put the implants there. And so they ask me, are you sure about this? Yes, absolutely. I already did your surgery in the computer. We can do this.
So when they go there during the procedure,
they're in La La Land. I tell them this is going to be Margarita Land. You have, 4 or 5 margaritas. That's where you will be. Many of them, they just don't want to be aware during the procedure. And
what about afterwards, by the way? Like, what's the downtime?
Okay, I would say you will feel very, very good after a week. But I have patients that they have gone back to work at the 4th day. Maybe some small bruising around the face. A lady, as a matter of fact, the other day, she said, I went back to work at the 4th day. Some makeup here and there, and it was all done. And pain is very well managed with our patients. Our surgeons are fantastic at doing that. The typical story is this. They go home with pain meds. They have one pill the first night. They get a little bit of an upset stomach, because it does happen. It's something that happens with this medication. And then they say, I'm going to stop it because my stomach is a little upset. They take ibuprofen, regular Tylenol from over the counter. Good.
Okay. Well, obviously pain is different for every patient, so we don't have to put disclaimers everywhere.
Yeah.
But it's different. But for the most part, it should not keep you. The fear of pain should not keep you from doing this. That's your opinion.
Patients, what I've been told many times is, I thought this was going to be so much worse. This was not as complicated as I thought.
Is this one of those things where they say, I should have done this years ago?
Yes.
When it's all done?
Yes, absolutely. They've been in dentures for such a long time, or suffering with their bad teeth for such a long time. And they always say, like, I wish it was this simple and I would have done it many years ago. And what I tell them is, you know what, stop thinking about the past. Stop thinking about, what you could have done. Just think about the future you had ahead with your new set of teeth.
I know you brought photos.
Yeah.
And for the sake of time, let's go to those right now. What'd you bring?
Okay. So this is a patient. She, as a matter of fact, we saw her last week. The way she started, she had bad teeth, periodontal disease. Nowadays, I want to take some time here to say, people need to be aware that periodontal disease is related to heart disease. So for me, it's awesome that by doing this, we're not treating only the mouth, but the overall health of our patients. So
this woman comes in.
Yeah.
She is headed to dentures.
Yes, she's headed to dentures. She owns her mortgage company. She is a very public person, great career, great professional. But she feels her smile is holding her back. And we wanted to match her successful career experience with her teeth, right? And she is a sponsor of the Seahawks, a very public guy. And we did full set of teeth on the top and the bottom on implants. And this is a 2-week post-op, Randy. 2-week post-op. She looks fantastic. She was delighted. As a matter of fact, she's the patient I told you wrote us an email 4 days after surgery, just thanking us and saying that she was delighted with the way we treated her. And
how soon can they eat? Like, so a woman like this, by the way, with her teeth before, was it tough to eat?
Of course, because most of the teeth are mobile. They're
moving.
Yeah, they're moving. They hurt. The gums hurt. They bleed. And so it's tough for her to eat.
There's a lot of dentists, we've done some research, they do a lot of snap-in, snap-out attached to dental implants. At your centers, and I don't want to put words in your mouth, but at your centers, my understanding is that you just do fixed. Why is that? So you don't like the snap-in, snap-out?
I'm going to tell you a story that I had experienced the other day with a patient. He tried to compare it with cars, analogy with cars. And he said, I was told at this office that, I could have a Mercedes-Benz, which is what you guys do here, or I could have a Ford, which is the snap-on dentures. And I told him, you know what, for snap-ons and all-in-4, I don't like to use car analogies. Because when you buy a car will, it doesn't matter if it's a Mercedes or if it's a Ford. It will take you wherever you need to go, right?
Okay.
Okay. An all-in-4, compare...
You're calling all-in-4, meaning 4 implants and the full arch of teeth
attached
fixed in place.
Yes.
Okay.
What we do every day.
All-on-4, okay.
Yeah. So an all-in-4, it's not going to take you to the same place that a snap-on will. Okay, so that's why the car analogy, it doesn't apply. Because with a snap-on, you will not be able to bite on an apple.
Like with the front teeth?
Yes. You won't be able to do that. It will still move your teeth around. With our procedure, the all-in-4, I had a patient the other day, and I will show you her picture. She actually brought an apple to the chair. And as soon as we put her final teeth in, she bit into the apple. Oh my God, this woman was amazed by it. She was just like, it was so juicy. It's never the same as cutting it into pieces. And so you can't compare those two procedures.
So when they're all healed up, though, with what you're doing, a fixed set of teeth, they're healed up, they can eat like broccoli raw or bite a carrot with the front teeth if they want to. So whatever they want to eat,
corn in a cup. Corn in a cup is one of the biggies. Yeah, yeah.
Okay, good. Now, you brought more photos. What else are we looking at?
This is another patient. She's 87 years old. And I know a big thing, many times patients, they say, am I too old for this? No. You are not too old for this because you're only going to live your life once.
Well, how old can you be? Aren't they more likely to fall out if you're 90 years old?
No,
really?
Not
Statistically,
at all.
They're not?
No. If you have the bone, and like I said, we're usually really good at finding it, it's going to be the same. So this lady, her teeth didn't look bad before. She was wearing a denture for 30 years. And her main concern was, she wanted to be healthy eating. And she can't eat any veggies because that's impossible with dentures. And the other thing is she wanted to enjoy the weddings of her grandkids and the receptions. And she was like, okay, I'm done with this denture. I'm going to have a fixed set of teeth. And for her, if you look at the before and after pictures.
Yes.
The after picture, can you see how her mouth is open? Because she's not holding the denture in by biting on it while she smiles.
So her lips are kind of covering her teeth on the before.
On the before, and she's actually with her mouth closed. Because if she opens the mouth, the denture falls out. As compared to the second picture where the teeth are attached. So she just laughs out loud. And you can see everything and they won't come out. And she was able to enjoy the wedding of one of her grandkids.
On these consults, when the patients come in, do you ever get excited? Like when you hear a little bit about their story, do you ever think this is going to be good?
I cry sometimes.
Oh, really?
Our patients, they have very touching stories sometimes. I can feel their heart, how much they've suffered throughout the years. And this is the best part of my job. I get to change their lives. I mean, we're talking teeth here. But
I know denture wearers. I never hear them complain.
Well, because they don't go to you to complain. They come to the dentist to complain.
Good point, okay.
So, and they think, they don't know sometimes that there's better things out there for them. And they just settle for dentures. But when you see a lady, 87 years old like her.
And the teeth look good, by the way.
Oh, thank
you. Looks like a natural smile.
Yes, yes, and that's the point. That's the whole point of what we do.
Very nice. Now we're going to take a quick break, and more. You have a couple more photos, and a little bit more about what the consult's like as far as options for denture wearers. You're watching the Wellness Hour. I'm Randy Alvarez. We'll be right back.
There's a way to get a life-changing new smile at one place in one day. The ClearChoice way.
I had an accident and lost a great portion of my upper jaw. I lost 6 teeth. There was infection.
We're doing amazing transformations. We have expertise that you might not find anywhere else, all in one location.
In just one day, under one roof, ClearChoice can give you a long-term solution so you can get back your smile and your confidence.
When they handed me the mirror, I was overwhelmed with unspeakable joy. To restore to me not only the use of my teeth, but my smile and my zest for life. It was just amazing that I got all of that accomplished in one day.
Not just another dental procedure, this is a true life changer. The ClearChoice way. Call today to schedule your free consultation.
You're watching the Wellness Hour. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest, she's a prosthodontist, and she says, no more dentures. Okay. Now, for people just tuning in, I guess a big part of what you deal with is people that their teeth, they have a mouthful of teeth that are just like failing, coming out.
Yeah.
They've been told you need dentures.
Yes.
And you give them a fixed set of teeth on the day of the procedure.
That's correct.
A full arch of teeth that don't come in and out. And then, but isn't it true if your gums are bad, like bleeding gums, gum disease, that your gums aren't healthy enough for dental implants?
Well, when we take all the teeth out, and during that surgery, the bone is cleaned and all, the periodontal disease is gone, okay? And so the bone that remains is going to be healthy bone, and actually the implants, once we place the implants within the bone, they're going to hold the bone levels, so you won't continue to lose any bone as you were when you had the periodontal disease.
So you could have bad gums and still get this procedure?
This is actually one of the best options for people that they're losing their teeth to periodontal disease.
To get this done? Okay, and as far as the denture wearers, what's their number one question when they come in? What do they want to know?
If they're going to be able to chew whatever they want. Most of our denture wearers, sometimes dentures can look good, but the problem is the function. They can't chew. It's not real. It's not something that stays in their mouth. And so they want to know, am I going to be able to chew steak big on guys?
Okay.
My guys, they just want to chew, on steak. And they want to be able to, like I said, bite on an apple, corn on a cob, do the veggies, all that. And when I tell them, yes, you can do all that, just don't chew on ice. That's the only favor I'm asking you. They're like, okay, I agree, I won't chew on ice.
No chewing on ice. You brought an email, and I said, I don't know if I can read it on the air, but this person, because I know ClearChoice does a lot of advertising.
Yeah.
And she said, of course, talked about how great everything was, very, very, very happy. And she put exactly as advertised.
Yeah.
Because some people are skeptical. They see it just seems so easy.
Well, they don't
to
believe
walk in with no teeth and walk out with teeth.
They don't believe that it can be done on the same day. They even think that they have to go home and heal and then come for their set of teeth. And then it's when I explain them how it works. And it's because our implants, wherever they're placed, they're spread apart. Okay? And then we put this prosthesis on top of them that splints them together. And so by splinting them together, that chewing that you're going to be doing with them, it's going to be evenly distributed all around, and that's what allows us to do this all in the same day without compromising the integrity of the implants.
Okay, good. Now you brought more photos.
Yeah. So this is another patient. She is awesome. So this is the patient that we were talking that she brought the apple to the office the day of the delivery. She was very involved with her church, and she was doing a lot of hosting and speaking with the people from the church. And she was, embarrassed, ashamed. She was holding herself back. And so she was someone that was headed to dentures. She was feared of getting to that point. And that's where, when she found ClearChoice, she came to our office. We did a full set of teeth again. And now you can see her after smile.
It's a pretty smile.
Very nice smile. An outgoing patient. She comes into the room and she's just like filling the room, making jokes, having fun. a whole different person.
Now, this is like an extreme makeover. So when she sees her face, do you remember that by any chance with her? Like when she sees those teeth for the first time.
They can't, it's the same story all over. They just can't believe it. I mean, their faces, if you could be there, I wish every patient could be there that first day, because their faces, they just light up. And that's where, you know, I start crying too sometimes, and it just makes me so happy with what I do. And actually the staff comes in, and it's a big moment in the office.
So sometimes everybody gets choked up.
Yeah, absolutely. Now let me show you this patient, Randy. So her, she was wearing a partial. That's something that we also get. Many patients that they have partials and they just hate them. And unfortunately, partials, sometimes after wearing them for a period of time, they start loosening up the rest of the teeth in the mouth as well. So they're slowly transitioning into dentures. In her case, she fell. She had an accident in the kitchen and fell, and she knocked up all of her front teeth. And she's a beautiful woman, as you can see. All she needed was a smile that could match her face. And,
very nice.
And she did. And sometimes people, they think about the investment of this. And because we use 4 implants only.
Because insurance does not cover this.
No.
And Medicare doesn't cover this and things like that.
No.
You have financing available, things like that.
Yes, we have.
Sorry to interrupt you, but
yeah.
Okay, so they worry about the cost, but?
We have people that help in the office, our consultants. They help our patients find those resources.
Okay.
And because they're so motivated. As a matter of fact, we delivered her teeth the other day, and she told me, you know what, Doc, this is the best investment I've done in my life. If I would have had to sold my wedding ring to do it, I would. I was like, well, I'm glad you didn't have to. And she was like, yeah. And now I go to work, and all I can think of is, I'm doing this because I have to pay for my beautiful smile. And she loves it.
So this is the hottest, newest thing in dentistry right now.
I would say so.
Do you think 10 years from now, 20 years, whatever, the dentures, the way we know them today, will be gone? Everything will be attached by something?
People get them sometimes because they don't find the will in themselves to start something like this, or because they don't know. Good. And to those that don't know, that's why I'm here.
Come in there and do it. Okay, good. One more photo. We have time for one more photo. We're out of time.
So one guy in there, this is an amazing story because he had his teeth. He was one of my male patients that he didn't care about the aesthetics. He didn't care about the beautiful teeth in the mouth, you know. He wanted to chew steak. That was his thing. And so we did a whole set of teeth. He was never smiling. Very serious guy. Very, very serious guy.
Looks nice.
And even the wife, you know, said, oh, yeah, my husband, he's, you know, serious and all. And so when we delivered his set of teeth and he came back, the wife was telling us of this huge transformation she saw in her husband. She said, this is like I have a new spouse. He's always smiling now. And like I said, all he cared was about the function at the beginning, but all of a sudden we turned him to the dark side of enjoying a beautiful smile. And it changed his personality as well. She even said to me, you know, I was married to a grumpy guy. And all of a sudden after he had his teeth in, no more grumpy guy. He was like enjoying life. He was so happy, always smiling. And
so now, since all he wanted to do is eat, and now he likes to smile, did he tell you his eating stories? Did they ever tell you their eating stories? They come in?
Steak was his main thing. You know, he likes to do barbecue and stuff, and so steak was his thing, yeah.
We are out of time. Okay, so somebody watching this, they're headed to dentures, right? Their teeth are bad, or they're wearing a denture now. What do you say to them? And maybe they're skeptical or afraid.
I say we have a free consultation for them. Come, meet the team, see our facilities, see what we do, and just know your options. And like I said, most of the times we're able to find the bone in there. We're able to help them find the resources, economical resources to do this. Just come to the office and you will see the experience of being with ClearChoice, and we'll get your hand and walk you through the whole thing till you can have a full set of teeth.
Do they get to see you?
Yeah, absolutely, on every consultation.
So is that right? So they'll see you.
Yeah.
And do they ever say, boy, are you the dentist? Are you the prosthodontist?
Oh,
Because you look very young.
As a matter of fact, I had the patient the other day that he was like, oh my God, you're so young. Your parents must be so proud of you. And I'm like, well, you know, it's been a lot of studying and a lot of working, and I'm finally in a point in my career where I'm just happy to serve them.
Okay, good. So nothing to be afraid of, free consultation.
Just come and visit us.
Okay, good. I want to thank you for coming on the show. Very good.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
There's a way to get a life-changing smile that's designed to keep you comfortable. The ClearChoice way.
Big fear of the dentist. Never liked to go. Always made excuses. It was a nightmare. I started looking for alternatives.
We created a wonderful environment for patients to just totally relax, from the front desk to the surgical suite. We just want them to have a wonderful experience.
If the phrase dental implants leaves you a little uneasy, you're not alone. At ClearChoice, pain management is part of the treatment. So you can rest assured we'll do our best to make you as comfortable as possible.
We're able to diminish the discomfort that you experience. It starts with IV sedation. We're able to place the implants and put in teeth the same day. It's just a wonderful thing that we're able to do here. We're able to actually transform lives.
Not just another dental procedure, this is a true life changer. The ClearChoice way. Call today to schedule your free consultation. There's a way for a life-changing smile to fit your budget. The ClearChoice way.
Meeting people is my life. I had to be careful how wide I would open my mouth because I was embarrassed to show my teeth. I was getting ready to buy a new shiny red pickup. As I was getting ready to purchase it, I made a decision it was time to do something for myself that was going to be permanent.
You might be wondering if dental implants are worth it. But what if you never had to think about, worry about, or cover up your smile ever again? What if you could have beautiful new teeth at a cost that works within your monthly budget?
I don't know how you would put a price on such a change in your life. To make the investment wasn't a tough decision at all. ClearChoice gave me that solution. That was one of the most important decisions I ever made in my life, and I have not one single regret. But I will get the truck.
Not just another dental procedure, this is a true life changer. The ClearChoice way. Call today to schedule your free consultation.